Hello, everyone, and welcome back to the Manifesting Health series. I am thrilled to have Nelson Tuazon, a long-term member of the Academy of Medical Surgical Nurses, AMSN, and the chair of the organization's Awards, Grants, and Scholarship Committee. He is also the Vice President and Associate CNO at University Health in San Antonio, and he has over 40 years of experience in practice, academia, administration, and executive leadership. Nelson, thank you for joining us.
Thank you, and really appreciate the opportunity to be with you today.
Excellent. Thank you so much. And I know you and I have talked briefly before this, and there's lots of other great, amazing things that you're doing, and we're going to get to that. But can you tell us a little bit about your history and where you can, how did you get where you are today?
Sure, thank you. So, as probably most Filipino nurses that came to the United States, I started out actually in academia. I was the assistant dean of a university before I came to the US. And as a Filipino nurse, if you want to go to the US, you become a nurse. So there's actually about 8 of us in the family of nurses. My sister, my cousin, my wife is also a nurse, and now my daughter's a nurse. So I started out as a staff nurse in the operating room in the Philippines and started my career in academia. The university where I graduated hired me. And as they say, everything started from there. I really love academia. I still remember when I went to my guidance counselor, she told me I could be either a teacher, a farmer, or a preacher. And then I went into nursing. So I think I'm doing the same three things. I teach, I preach, and I educate. So I came to the United States in 1987 and started out as staff nurse.
And nurses kind of
Uh,
span that whole everything in there.
Absolutely. I started out in New Jersey, and it's been a fantastic journey. I started out in a medical surgical nursing unit, and I've been a med-surg nurse from the get-go. Even as I rose through the ranks of a manager, director, and as a chief nurse, I've always leaned towards medical surgical nursing. So
So you talk, go ahead, I'm sorry.
I've been with AMSN for the last at least 10 years, actually going back to New Jersey in 1989. 10 years as part of the AMSN National in terms of being, as you said, I was the chair of the Awards, Grants, and Scholarships Committee. And I've left that committee since then, and I now am a member of the Convention Planning Committee. So I've always been part of the Academy of Medical Surgical Nurses.
Excellent. Thank you so much. And being in the medical surgical area, one of the largest populations of our patient populations within healthcare systems, across the U.S., but even beyond that, there's a lot of influence that's part of that. And you being a male nurse in that space as well says a lot. A diverse male nurse, going even further, says a lot to being able to advocate and share your experience with others. So can we talk a little bit about how you brought a different perspective to not only your historical background, but as a man caring for being in the nursing profession? How have you helped your medical surgical colleagues to recognize the value within diversification of the workforce?
Sure. You know, Traditionally, when you talk about men in nursing, you see them in ICU, in ER, where there are more males in those specialties. But I can tell you I'd say in the last 10 years in medical surgical nursing, I have more men that have come to med-surg as well. And I think we have done a great job in sharing our expertise. We're not just being called because we are able to lift heavier patients. We actually are known for being compassionate because, especially for men, patients who are men, they appreciate that we can relate to them. We
Right.
understand their needs. Not that female nurses can't, but I think there's that identity that a male nurse can bring the same level of compassion and level of care to a patient. I've had nurses as well start from nursing school into medical surgical nursing. And we have done a great job of saying that medical surgical nursing is a specialty. In fact, I've been biased towards med surg as the very, very first specialty. To be a medical surgical nurse, you have to know a lot. We communicate with our patients. From the very beginning, we are the conduit of communication to the rest of the team, especially with the physicians. And so I think men in nursing have gone a long, long way. I've also had male nurses or men in nursing that have become leaders, directors. I have a few of my colleagues that have become chief nursing officers as well. So I think there's a lot of space in nursing where men are not only welcome, but we actually thrive.
So true, and I'm glad you mentioned something earlier, talking about how you find that your patients are more receptive, and it's not because our female colleagues they're not receptive to our female nurse colleagues. It really is about being able to recognize and for us to represent the patients we're caring for. Patients want to see themselves, whether it be a gender or a similar age or race, and so forth, within their care providers, and to be able to see that we've got mounds of evidence that talks about better outcomes within those populations. And we've seen a lot of movement in that direction with men's health clinics and so forth. So we're starting to see that. And I'm so glad that you're part of that movement. Do you find that your colleagues are pretty receptive to that as well? Whenever, say, for example, if a patient says, is there a man or is there a male a nurse or something, if they ever encounter that situation where the patient is asking or requesting for a male nurse, do you find that your colleagues, your female colleagues, are receptive to that?
Sure. I think it goes both ways. As I've said earlier, I think the idea that we need men in nursing because of the physical strength that they have, but there's also this might be anecdotal, but I see that patients who may be agitated or may need more reassurance, they seem to respond more when there's both male and female in the room as well. So I think the psychology that they can relate to the patient as men, I find that is reassuring for both the female nurse and the male patients as well.
I appreciate that comment when you're talking about really gives a team approach to both all of
Absolutely.
our colleagues, our gender colleagues from both areas, to be able to say, we have people that can help you. This is who we are. We are a team of nurses for a very complex group of patients within that space. So thank you, and I appreciate that.
Sure.
So one of the things we were talking about earlier is that, yes, you have extensive experience within the clinical practice side and within leadership and within the medical surgical space as well. Can we talk a little bit about how your advocacy expands beyond that? What are some other things that you're working on that can help bring more and more people into the conversation of not only diversity, but understanding specific diverse patient needs as well?
Sure. So, with humility, in 2024, I was actually awarded by the American Nurses Association with the Chrisman Luther Award. And I was supposed to prepare a speech, and I was gonna joke. I'm gonna tell a joke as my wife was in the audience. I said, I was getting ready to retire at that time. And then I found out that Luther Christmas served nursing for 65 years. And I
Now you
said to
have a
my
goal.
wife,
Now you have a
yes,
goal.
I said, I think I have more years to
Yeah.
contribute. But set aside, I think the idea that men in nursing, and also any nurse for that matter, we have the space in academia, which Dr. Chrisman was, and I've been as I've said, I was an assistant dean. So I am very close to academia. I am an adjunct faculty in a few colleges, and I love the idea that we can share the experiences that we have with the nurses, and so we contribute to workforce development. I'm also very close to nurses in the community. In 2018, I founded what we call the San Antonio Nursing Consortium. We started out actually with three organizations, and two of them are minoritized group, the Hispanic Association and the Philippine Nurses Association. We formed the group together with Nurse Executive Group in San Antonio. It's a handshake organization. My experience is I go to many organizational meetings and you see the same faces.
Mm.
And I said, it'd be great if we have certain organizations come together and meet. And we started out with those three organizations. I figured if 10 or 20 of each of us came, that'll be a great group, right? With our first meeting, there's 80 nurses that joined from the three organizations. And after that meeting, we decided, let's do this again. And now we have 18 nursing organizations in San Antonio.
Wow.
And the minority groups that are involved with this are the Nigerian Nurses Association, the Black Nurses Association, the Indian Nurses Association, Black nurses, Hispanic nurses. And so three of the signature events that we have, we go to the community and do the Stop the Bleed. We
Mm.
also have an annual patient safety conference. And the one that's coming up is we celebrate nurses. We have the best 25 nurses of South Central Texas. So you imagine we are to celebrate 25 nurses. So we said, let's start small because there's the 100 nurses in many states. This year we have 700 nominees.
That's
We are
impressive.
celebrating 25 of those 700 nominees, and they come
Wow.
from different groups. And key of the leaders in this organization is the president of the Academy of Medical Surgical Nurses, who is a Nigerian male. So we have spaces in community leadership.
This
I'm
is
I'm very I'm very, very proud of that.
This is great. The stories that we talk about, and we've had several guests on here, and we talk about our collaboration and what we're doing with the Men in Nursing organization as well. There's so much power when it comes to that collaborative effort because again,
Mhm.
we can't. We've talked about this before, and here we are talking about it again. You cannot do it alone. There's too many of us. There's too many of us with
Uh-huh.
like stories. There's too many
Uh-huh.
of us that we really are working in the same fashion. We're doing a lot of the same effort to compound that in a way that's meaningful and to pull us together into like what your initiative
Mhm.
is with the consortium truly shows impact at a much bigger level, and that's something that's very commendable, and thank you for what you're doing. So I want to shift on our last couple questions that we have, shift
Sure.
into if you have individuals that are watching our show with us, the Men in Nursing
Mhm.
organization has quite a few students as members of our
Mhm.
organization. What would you say to them to get them interested in the medical surgical units, the medical surgical population?
Sure. So, I want to thank you for that question. Let me frame, maybe I could use an acronym. I'm kind of, I love doing that so I can remember them. So I'll start with the letter V. I want to say be visible. So as a student, join organizations. Uh, in our case, the San Antonio Nursing Consortium, all our member organizations actually offer free membership to our students. So we have students that come to us with free membership, and then we offer them scholarships. We offer them the opportunity to join our education programs for free. So I think that's part of us to be able to be visible to the community. So that goes both the students and the leaders in nursing. The other one for, I want to say be an owner. Own your destiny. If you want to aim for something, go for it. And consider joining an organization because then you have networks that can help you, and you can find mentors in them. Then I'd say make an impact with the work that you do. Make an impact, and by creating an impact, you have influence. So now you're visible, you're owning it, you have an impact, and then you come with a C with this community. So we are a community of nurses, and we celebrate. we we connect. So a lot of letter C's there, right? So connection, we create excellence, and we celebrate nurses as well. And the last letter that I would say is empowerment. Make sure that you empower yourself to seek out mentors, seek out opportunities, and empower others. Because when you allow others to be excellent as well, then we come as a much robust organization. So I say letter V, be visible. O, own it. I, make an impact. C, celebrate and connect. And E, empower. So that's the voice that I want to bring to all of us.
Excellent, thank you. And Nelson, this has been a great conversation, and we've talked about a lot from not only the medical surgical space, but even into leadership and advocacy. And I appreciate
Yeah.
your takeaway with the voice mnemonic. It's very helpful for us to sort of frame how we are professionally and
Mhm.
frame how can we become more professional. So it's really a powerful message. I appreciate you sharing. Nelson, thank you again for your time with us. I appreciate what you're sharing and all the immense work that you're doing. And I look forward to possibly chatting with you again soon.
Yes. Thank you. Thank you for this opportunity to share.
Absolutely. And thank you all for watching the Manifesting Health series. See you again next time.